Welcome to Community Matters for another day. Thanks for joining us. I'm Ian Pilkington. Guest in the studio today, someone I've met for the first time today and already told my life story to. So she's absolutely fed up with me and wants to talk to everybody on the radio. Emma Corkery. So Emma, you are you're representing the Wellbeing Hubs in the city, aren't you? Which may be a term that people have heard of, maybe isn't. So let's start there. What is a Wellbeing Hub?
Yes, so a Wellbeing Hub is, we can think of it as a physical building initially, but it's more than just a physical building. So Wellbeing Hubs are places where people can go if they want to access advice and information. So that could be about benefits, welfare support, some mental health support. We have physical health activities and lots of different social activities that happen in the Wellbeing Hubs. So the main aim of the Wellbeing Hubs is to support health and wellbeing of people in their community. So we have Wellbeing Hubs dotted around the city to represent different community locations. But then, of course, we have activities that happen outside of those physical buildings. So initially we could think of them as hubs, buildings, but also citywide services.
So hearing the term Wellbeing Hub, thinking of the way the word well-being is used quite often now, they're not gyms necessarily, and they're not necessarily places you go for therapeutic counselling, as is. So is it something therefore that's open to anybody to access services? What would a day in the life of somebody working in a hub and connecting with a hub look like?
Definitely they're open to anyone. And it's interesting that you say gyms as well, because a couple of our Wellbeing Hubs do have gyms in them. And some of them have like exercise programs or physical activities happening in them. But they are a space for anybody to go, anybody at all from the community. So probably it's best if I describe them as there's 10 different organisations. They're community-based organisations that have already existed for a long time in the city. Actually, yesterday I was with one of the organisations, Improving Lives Plymouth, and we were looking back at the history, and they used to be Plymouth Guild, but now it's called Improving Lives Plymouth. And back when people were returning from the war, there was like a pamphlet that was made, and it listed all of the different community locations where people could go for help and support coming back into Plymouth, and they were listed on there. The YMCA was listed on there, and those two are still acting as Wellbeing Hubs now within the city. So so they are, those are already existing. Yeah.
Those are both places that people would know. I know Improving Lives, or I know the Guild, and they're caught up with a new name. I know the YMCA, although conversations with Tom Lavis at YMCA, we do, people still have a funny idea about what the YMCA is and what it does. But they're well-known names in the city, organisations that people think, I know what that is. So if we took, say, let's pick either the YMCA or Improving Lives, what is it about them that makes them a hub? What is it about what they do? Because people will probably think, I know what they do. What is it that they have that is part of them being a Wellbeing Hub?
So the Wellbeing Hub organisations have chosen to work together as a network. So that's really what makes them unique. And it's not that we're exclusive, like there's lots of other community spaces around the city and we work with them as well, but we've chosen to work together in a Wellbeing Hub network, and that is part of Plymouth's public health Thrive initiative. So that's to support health and wellbeing of the residents of Plymouth. So Wellbeing Hubs, as part of that, they advise. They all have that core offer of advice and information, befriending, volunteering opportunities, mental health support, physical health support. So a day in the life, anyone could walk into a Wellbeing Hub, and you might come in for one thing, say, I need some advice about this thing that's happening in my life, or I would like to join a art and craft group or something. And usually people come in for one thing, they speak to a Wellbeing Hub advisor. So that's something that's unique about the hubs. They each have a Wellbeing Hub advisor, and that person engages in conversation with them. We call it appreciative inquiry, or just open-ended questioning, really, to find out what is it that person needs, how can we best support them. And usually through that conversation you find out, I've come in for one thing, but actually there's so many other things happening here that would be right for me, and that's what I'm really hoping to access. And that's what improves people's health and well-being, is going for one thing, finding out about so many more opportunities, and then feeling part of a community.
That's a really helpful intro. Emma, we'll take a break for some music. We're back with Emma talking more about Wellbeing Hubs right after this. We're talking with Emma Corkery about the Wellbeing Hubs in Plymouth. Emma, thanks for that intro. It was super helpful. A bit of a description of what the Wellbeing Hubs are. I think that conversation began to go down the road of how beneficial it is for people to come into a hub for one particular thing, one access point, whether it's information, advice, or other services that are on offer, and then find other things. How important, or what kind of outcomes do you see, or are the people in the hub seeing from people finding other people and getting involved in other things? What is that actually doing? Open that up for people's well-being and health.
Yeah, I think, that's a really good question. And there's so many lovely case studies that I get through the Wellbeing Hubs so they report back to me on a quarterly basis. And there's always so many amazing stories of the way in which accessing Wellbeing Hub has impacted somebody's life. I think it would be really hard for me to even pick one, but say, for example, you could have somebody come into Wellbeing Hub and maybe initially they are there to access some services, and then after a while they feel supported by that, and then they think, oh, this is an amazing place, I'd like to volunteer, and they get involved in some volunteering there, and then through that volunteering experience they get employment either in the hub or somewhere else in the city, and it just has that really positive impact on their life. That means their whole life has changed. Now I've come from being in a place where I was unemployed or never had a job, and was really struggling with my mental health and my financial security, and now I'm employed, and it's all because I walked in that door, accessed something, started to work with other people, realised that I have this whole community around me, and my life has changed. That could be one example.
One example. And I guess you wouldn't need to be in crisis to access, because sometimes people, often as human nature is, we'll wait till the last minute, wait till my arm's completely broken and hanging off, and then go to the doctor and say, can you do something with this? As I heard somebody describe it. But the hubs, I guess, 12 hubs you've mentioned across Plymouth in different locations, and we can check out where they are later and let people know. But not being in crisis to access services and still finding a better quality of life, is it something that's therefore open for all ages? Pretty well, maybe not children, but all ages? Yeah,
definitely all ages. And our hubs are also co-located in some places with family hubs, so that does mean that we have services for children and families as well. So really it is absolutely anyone that can come into a Wellbeing Hub. And one of the reasons for us co-locating with family hubs or working closely with them is that people are not separate from their families. So if you're an adult and you go into a Wellbeing Hub to access a service or some support, then often you will have a family as well. So it just makes sense that our services and our understanding of how to help people is across all ages.
Yeah, I was talking with Kate and Maddie from Memory Matters and Moments Cafe, and they're saying similar, that their service isn't. It does go right through the family, because everybody's affected by the things that people are trying to find help for. So,
and it could be something really nice that you're coming in for. It doesn't have to be I'm in crisis or I feel really isolated. It could just be I'm looking for a fun activity in my community. What's going on in here? Popping in and then finding a group and thinking, oh, I really like this, I like these people, and just becoming part of a community that way. But equally we're there for people who are in a crisis point, that are desperate and need some help for whatever reason that might be.
And thinking back through just the experience of being in Plymouth in the past, those kind of help points have been, well, it's been hard to find something that's the light touch version of that, of where can I go and find a Scrabble club, a Macron, whatever. Hard to find one place for that. And where can I go for advice on some of the crunchier issues of life tended to be one location, whether it was city centre or whether it was the council or whether it was in the main hospital or wherever. Is part of the idea of the hubs that they're more located in accessible places throughout the city?
Yeah, exactly. And that you can get a number of different things all under one roof. So yeah, the hubs are located right the way across Plymouth. And there are some places in Plymouth where we don't have a wellbeing hub, but we might still have a presence because the organisations are running an activity or have pop-ups or, are connected with those communities. And I think since I've been in my role, it's just really opened my eyes to how many different grassroots organisations there are, how many different communities are active and helping people across Plymouth. So we work with over 50 organisations across the city anyway. So you can go into a hub, or there's not a hub, but we're connected, we can signpost you. I think that's one of the beauties of the hubs, is that those hub advisors are like a walking encyclopedia. They know everything that's happening, and if they don't run that service or have something that can help a person in that hub, they know where to tell you to go. But it won't be like, oh, just go there. They will help somebody to get there. So we'll hold your hand, will help you to access that support. And I guess it's also worth saying on that note that we work really closely with the community builders. So they are people that are out in the community, and some of them have physical locations, so areas that they work in, and others have communities that they work with. So they work citywide, but with particular communities. And we work really closely with the community builders so that they inform us, what could be beneficial for a particular community. How can we support that group? What new group could we set up? Yeah, they look for assets already in the community and they support them, and then help us to connect with the community that way.
Let's take a break for some music. It sounded like there's quite a joined up piece of work going on. We'll explore that in a moment, Emma. So we're back with Emma talking more about this right after this next track. Back on Community Matters with Emma Corkery, talking about the work of the Wellbeing Hubs. Check out Listen Again pages. We'll let you know where you can find those on our website if you missed any of this interview. Emma, you've talked a little bit about the connectivity you had through the community builders in the city. And that speaks of a wider, more joined up piece of work going on in the city. How's Plymouth doing? Is it, we love supporting the good stuff on Cross Rhythms, but we don't shy away from talking about, hey, where are we growing? Where are the challenges? How do you think Plymouth's doing as to serving the needs of people in different communities? Rubbish question, but we did have another question before that. It was off air.
I know what you mean.
You go and do that question that we talked about earlier.
So I think it's really amazing in Plymouth for the way that organisations want to collaborate with each other, and especially in this realm of community work. Just, I guess, on a personal note, so my view of Plymouth, I'm not from Plymouth originally, but I have lived here for a while. I also moved away, so I'd lived here for about 8 years on and off, and then moved away and came back, and I was away for 7 years. When we came back, it was very different, and this was 2 years ago we came back, and I felt, wow, Plymouth is a really difficult place to live right now. And walking into the city centre, and it was all, a bit of a mess. And and I found that first year coming back really difficult. Also because I'd lived somewhere really sunny for 7 years, so I think the weather was part of it. But
you leave Britain then, did you?
I did, yeah. I lived in Southeast Asia. But coming back and then coming into this job, I found actually so much positivity and so many people that want to help the community and are doing such amazing things. And it doesn't feel, I know from my position it's probably different, but it doesn't feel really competitive. It feels like people want to work together, they want to collaborate. And I get that sense because I work for a network, and that's organisations that have chosen to work together. But I do see that with organisations outside of the Wellbeing Hub network. We work with lots of other people, and everyone is wanting to help the community. And I really enjoy seeing that. I think it's so great that there's just that proactive, collaborative, creative approach that's the undercurrent of Plymouth.
There's a lot going on, isn't there? You've got what Nudge are doing. You've got what other places are doing. The word hub is getting used everywhere. You've got Stoke Village Hub, which I obviously would know about, and it's not necessarily, that's not the same thing, but there's a lot of investment into on the ground in a local area, connecting with that local community for the benefit of that and empowering, not just engagement, but empowerment for local communities, local people to be part of their own growth of community. My words are rubbish at the moment, but that kind of positivity is. So from your experience living in other places, do you think we're ranking above the median, below the median in that kind of thing? What would you say?
Yeah, I think it's really good here. I think definitely it's really nice. There's such a sense of community, and where you could look at it and think, oh, there's loads of deprivation, but although there is that deprivation, we can't shy away from that. That's why these organisations are doing all this work. There's so much positivity and so much of a proactive approach, and I really like empower that you use there, because that's what we want to do as wellbeing hubs, is empower people to make healthier life choices that support their health and well-being. We're not there to say you must do this and we know the best way for, to support your well-being. Individuals know the best way to support their well-being, but maybe we can help support that by the services and the different activities that we have in the wellbeing hubs.
Brilliant. Well, there's quite a bit going on, and you could name more than I can name, and I can name a few just from talking with people and getting people in on this show. So it does feel like there's good stuff going on, and that it is stuff that can have lasting and widening impacts. I think you mentioned earlier, when someone comes into a wellbeing hub, then their whole family in effect is represented by them. And any benefit they get is going to be reflected in the family. And that's an ongoing benefit. These things are they maybe don't stack up on the numbers board, but they will do in 10 years' time. It seems to be the feeling that I'm getting from this interview.
Yeah, definitely. It's that preventative approach. We're working at that end, the prevention end, which you can't see that benefit straight away. That's going to take years to see, but actually that's the really important bit, and that's the bit that it pays off and is the most beneficial for people.
I'll ask a question that you might not want to answer, and don't if you don't want to. So prevention and the 10-year, 15-year, 20-year outcomes, difficult to fit in a political model where there are 5-year gearings towards producing outcomes?
Yeah.
Sorry, I was going to say, do you sit well? Not do you personally. Does the model of the hubs fit well in that? I think I think from what like Tom Labis and John Hamlin say, and others that work and have worked in the city for years, they all say we partner well with Plymouth City Council. It's great. We've got some great partnership work going on. Yeah. Are you finding? What are the frustrations in your job? What are the things that, without shooting yourself in the foot and walking out of here and thinking, oh, I've lost my job, what are the things that you think, oh, I really want that to change? Like, it might be just about the city or life in general, and changes that you think are going to come from your work. But what sort of things make it a difficult time for what you're doing?
I'd say funding. Funding is the main thing that comes up, and we do work really well with Plymouth City Council. So we work directly with the public health team. So the Wellbeing Hub network is part of Public Health's Thrive initiative, and so we do receive funding through them. But not just funding, like so much support through them and connection with Plymouth City Council. So that's really amazing. But I think I see organisations and businesses just in general across Plymouth just struggling financially. But what's really nice is that it still doesn't feel like we're competing and scrabbling around for the same money. It's we're thinking, how can we work together? How can we collaborate on a bid together so that bid can be stronger and it can help more people in the community? But yeah, I'd say it's funding, but that's really the place we are at the minute in our country. Yeah.
We'll take a break for some music. We'll go and cry about mutual difficulties with funding, and we'll be back right after this.
Yeah.
Emma, I dropped you a load. It wasn't meant to be loaded, actually. I'm just because I'm so interested in the conversation. I wanted to find out what the challenges are. So thanks for answering that. What does a great day at work look like for Emma Corkery in terms of, because you're program lead for the community hubs, aren't you? So you've got an overview of all of them, and you must be that must be a lot of relationships and a lot of feedback.
Yeah.
What's a good day at the office look like for you? What's a good day?
Well, I think good day for me, and this is what I like about my job, is that it's so varied. So I work across all of the hubs, so I travel around a lot and go and see them, but I'm always meeting other people that work in different organisations that want to connect with the hubs and build a relationship with the hubs. So I think variety is one of the best things about my job. And yeah, a good day is me having a strategic meeting, talking about a vision moving forward, and then going into a hub and seeing an amazing group that's happening there. There's one actually, one of my very first days at work, I was still visiting the hubs and seeing what's going on, and I joined in a group. They've called themselves this group, okay, so it's not offensive, but they're called Knackered Knees, and it's a group of women who are engaging in an exercise program, and they called themselves Knackered Knees Group. And
that's great.
Yeah, and they were doing some calisthenics, so that's like body weight movement. And they had a guy called Richard come in. He has his own business. I'll do a little plug. It's called Cali Motion. I go and see Richard as well. He's very good. And they were doing the calisthenics, and then after that session, then they were like, right, let's make the tea and get the biscuits out. And then they got out all their crafting materials. And so following on from Knackered Knees, then they move into their craft group. And that was really amazing. It was such a nice introduction to see this is what it's like. You come in to engage in some exercise, then you have that lovely arts and crafts hour. And then some of them then said, oh, we're going next down to Tolgu Woods, and there's like a group that we meet with there as well. Why don't you come down and see what it's about? And for me, that was a really good example of I've come to a hub, I engage in an activity here, but I've made friends here. And with those same friends, I now go and do something else, not related to the hub, but it's really good for my well-being. And it's all because we met at the hub and did this Knackered Knees program. And the reason they're on the Knackered Knees program or activity that they established themselves is because they had been on a Live Well program before that, which was about falls prevention and helping them to be more safe around their home and in their day-to-day life. And because of that service, then they had done this follow-on group.
So one thing leading to another, leading to another.
Yeah.
It really is. It's the simple things of life that really are the stuff of life, aren't they?
Yeah.
It's just the simple things and doing those things with other people. I wish Dave was in the studio because he knows this stat, and you might know it, but something like the financial outcomes in terms of cost to the NHS of isolation are on a par with the outcomes of smoking.
Yeah.
And that just says it all. That's like, okay, there it is. And some of us, like me, introverts, are like, yeah, I'm quite happy on my own, but honestly, I'm not. I am quite introverted by nature. I do like my own space. I'm comfortable in my own space.
Yeah.
But if I go a couple of days and I've not met many people, or if Karen's been away, or the kids are away, I'm like, it's not brilliant to be continually alone, is it? Yeah. But having a focus of something to do, a reason to be together, I guess. Yeah. I guess, is that a big part of what people can find in the hub then? A reason to be together with others?
Yeah, definitely. Yeah, and I think it just, we were having a chat earlier, weren't we, about the impact of social isolation. And when I've been talking to some GPs, so I've met really amazing GPs as part of my work, which I would also tag that into a good day at work, is just having more exposure to the amazing work that goes on through our primary care. And they've explained to me that journey. Someone becomes bereaved, and then because they're bereaved, they don't go outside and don't go for the normal walk that they might have done together previously. And that could be bereaved like through a pet as well. Like if you have a dog and then you don't have that dog anymore, you don't go out to walk the dog, you move less, frailty sets in, then you have a fall, then you end up in hospital. And it started with not having that social connection or that reason to go outside and to move and to meet people. And then it just has that detrimental effect, which does end up costing a lot of money, when the prevention end of it could cost nothing. Like it costs nothing to go outside and just to chat to somebody.
That's huge. And I mean, preventing things, isn't that the shift that NHS is taking now? It's moving more towards prevention, isn't it?
Yeah.
So so
the hub model just naturally fits into that idea of moving more into community. So now we're thinking even more, how can we build on that, raise the profile of what we do, and help to show that actually there's all this stuff that's happening in the community which is preventative. There's a direct link with that and health outcomes. And they're not just separate things. This is not a nice to have. This is an essential. We'll do this, and it will take some of that pressure off the NHS, and it already does.
That's a really good line. It's not a nice to have. This is an essential. We'll take a break for some music. We'll come back and hear some more from Emma right after this. We'll also tell you how you can check, listen again, and how you can engage with community hubs in a bit more detail. All of that right after this. Emma, wellbeing hubs, which you coined a phrase which I think we should get printed somewhere. These aren't a nice thing; they're a necessity.
Yeah.
And very often those soft touch things, the preventive end of our health and wellbeing, do seem like nice things and can seem like, oh, how important is that? It's just a nice thing to do. These are the things that stop the really serious stuff happening.
Yeah.
Getting people connected with other people and enjoying a better quality of life simply through those relationships and activities.
Yeah.
So really important things, and devolve throughout the city in a whole range of places. First up, is there a website where people can go and say, right, this is where all these things are? I can just look at a map and say, that's close to me.
Yeah. There's two places actually. So one is the Plymouth Wellbeing Hub Network website. So that's pwhn.org.uk. And there's also the Plymouth Online Directory. And there's a section on there for wellbeing hubs and family hubs. So you can go to that one as well.
Okay. And if somebody just did the whole Google or other internet search engine search on Plymouth Wellbeing Hubs, you'll find it that way.
Yes.
Yeah. Okay. Now, here's a little challenge. So you said, and that you would like to name them all because you want to, and to your credit, you say, no, I want to profile everybody and give everybody mention and give everybody airtime.
Yeah.
And I'm sitting here thinking, well, you got to name 12 locations now. So
I know.
You're going to take the risk.
It's my own challenge, isn't it?
You go for it. Okay. So what are they called? Where are they?
So we have Four Greens Community Trust, which is in Whitley. We have, I'm going to go around in a little map in my head. So we have Southway, they have a wellbeing hub there. We have the Elm Wellbeing Hub, which is in Estover, just behind Asda. There's St Budo and Barton Wellbeing Hub in St Budo. There's Falston Park, which is in Devonport. So I'll say Brickfields because that's the Brickfields
of course,
site.
That's its new name, isn't it? Yeah.
Yes, that's right. We have Improving Lives Plymouth is another organisation that has two wellbeing hubs. So they have one in Manamead and they have one in the city centre. That's called Ernest English House. Then we have Bernardo's, which has two wellbeing hubs. So one is the Reece Centre in Plympton, and then Efford, which isn't open just yet, but will be opening very soon. Then we have the YMCA, which is in Honock Knoll, and we have Age UK, which is in Mount Gold.
Brilliant.
And the Jan Cutting Healthy Living Centre, which is in North Prospect.
Which you shouldn't forget because you're going to go there.
I'm going to go there in a minute. Yeah.
I've let this interview overrun, so you're going to leg it out this one moment. Look, it's been super helpful hearing about the wellbeing hubs. It really has, Emma. And the work that's going on seems to fit so much with what we know and what we hear from so many people across on these interviews of the need in Plymouth. And from personal experience, my mother-in-law, 94, in a different country, let alone a different city, but this kind of thing, super helpful. Yeah. If you had to say, because very often stepping over the threshold to access a service is the key difficult thing for people to do sometimes. A word of encouragement, if you could, put you on the spot again, one word of encouragement for someone who's hesitant, who thinks, I maybe I could do with connecting with someone, but I'm really not sure. I'm really not feeling confident. What would you say?
I would say just go in to your local wellbeing hub or any wellbeing hub. It doesn't have to be the one that's closest to you, and there will be a friendly face there to greet you. And that person is a Wellbeing Hub advisor, and they have a lovely role where they work with their community, they get to know their community, and they are there with just a wide range of knowledge of how best to support people. So definitely just give it a go. Don't be scared. They're there to help you, and they're really patient, kind, lovely people.
That's fantastic. That's really, really helpful. Emma, thank you ever so much for coming in this morning. I know you've got a busy schedule. I kept you long because I rambled on for ages.
We had a lovely chat. No, it was really nice.
I enjoyed it. It was a nice way to do a Friday, which is the day we're recording this. So thank you. But I know you've got a meeting to get to. So thank you very much for coming in. And hopefully we can come in again in a year's time and say, yeah, there's another 7 of these and life's going great for everybody. But Emma, thank you very much. And thanks very much for what you and everybody working in Hubs is doing for the rest of us in Plymouth. We appreciate it.
Thank you.
Thank you. So if you've missed any of that, you can check up the website crossrhythms.co.uk/Plymouth and check our Listen Again page. You'll be able to get our that whole interview with Emma on the Listen Again page online. And don't forget, you check in to the Wellbeing Hubs, find your local one. Just go to search Plymouth Wellbeing Hubs on your internet search engine. You'll find access points on just about all over the city. So well worth doing. Stay tuned, more music and life right through the day here on Cross Rhythms, and I'll be with you next time on Community Matters.